Welcome to the Dartmouth College Environmental Health and Safety Cleaning and Disinfecting Guidelines for Laboratories video in Phase 1. Today we'll be looking at guidance intended to help labs and research facilities identify approved COVID-19 disinfection methods for high-touch work areas and equipment. The cleaning and disinfection of high-touch surfaces in laboratory areas is the responsibility of research personnel. Be sure to wear appropriate PPE when performing all laboratory tasks, including disinfection of surfaces. At a minimum, a lab coat, gloves, and safety glasses should be worn when disinfecting. Follow the CDC guidelines, which recommend at a minimum cleaning at the beginning and ending of each researcher's work shift. Equipment and surfaces that may be touched more frequently and by multiple people during a work shift should be disinfected every 2 hours. The following are locations and equipment with high frequencies of handling and contact that should be disinfected: micropipetters and other shared tools, outsides of shared chemical and reagent bottles and caps, benchtops, lab doors, drawers, and cabinet handles, equipment handles, latches, controls, and touchpads, faucet handles and sprayer grips, soap dispensers, baskets, bins, and trays, chair backs and armrests, and fume hood and biosafety cabinets. Don't forget about light switches and plates, lab phones, keyboards and other shared computer equipment, bin, waste container, and water incubator lids, as well as pens and whiteboard markers. Use a disinfectant that is certified by the EPA to be effective against the COVID-19 coronavirus. To verify the disinfectant is on the EPA registry list, search for the product name or EPA ID number, which is located on the product packaging. The product label may also list coronavirus among the organisms for which it is approved. A common example of an approved disinfectant is Lysol wipes. 10% bleach in water is an approved disinfectant and should be freshly prepared every 24 hours. 70% ethanol is not recommended for all surfaces, though it may be appropriate for electronics and other delicate surfaces. Never mix cleaning products together, especially bleach. The following additional tips will help ensure lab surfaces are disinfected appropriately. Reduce clutter so that desk areas, lab benches, and other work areas can be properly disinfected. Wash visibly soiled areas with soap and water prior to disinfecting. Remember to pay attention to disinfectant contact time. Read the labels on all products and follow instructions for proper use, including required contact time, which is the amount of time a disinfectant needs to remain on the surface to effectively kill microorganisms. Spraying and immediately wiping is often insufficient, and most products need to be sprayed thoroughly and allowed to sit for 5 to 10 minutes. Follow the manufacturer's instructions on the product, or look them up online before using the disinfectant. Be sure to use care with delicate equipment and electronics. Certain equipment may be damaged by spraying and by harsher disinfectants such as bleach. If in doubt, you should consult product manuals or contact the manufacturer for cleaning and disinfecting procedure recommendations for the specific product or piece of equipment. If you have an approved quaternary ammonium disinfectant, such as Clorox Quat wipes or 70% ethanol wipes, use them for these more delicate tasks. If you do not have disinfectant wipes, delicate items can be disinfected by soaking a clean soft cloth in the alcohol or disinfectant and then using it to wipe the equipment, being careful to avoid getting liquid into any openings. The surface should be visibly wet after you wipe, and the disinfectant should be left to evaporate from the surface. Wash your hands thoroughly and often. Remember to wash with soap and hot water for at least 20 seconds prior to starting work, during your workday, between glove changes, and after disinfection procedures. Well folks, that wraps it up for this cleaning and disinfecting guidelines video. Thank you for watching, and if you have any questions, please contact EHS.